what to do with your medical degree. You've come to the end of all those years of studying, you've got your medical degree, now you have to make some hard decisions about what you're going to do with it. Some of the things you need to consider are, how many hours do you actually want to work in your life? You're going to be busy, but do you really want to spend a lot of hours working? Other considerations are, do you want to go into a specialty or an area that involves simply talking, pediatrics, neurology, psychiatry, or do you want to use your hands, be a surgeon, or do procedures? One thing you have to know in this regard is that insurance companies and governments, they don't put much value upon thinking and pay very poorly for it. This is very dissatisfying. Do you know, in the last couple of months I've heard of 2 young psychiatrists who have given up because they've been so disappointed with what value and level of remuneration is put upon your work. The other area you need to consider upon is, do you want to go into academic or do you want to go into private practice? At one extreme actually you might want to go into missionary fields and work in MSF or missionary work. This is great and idealistic, but you know, it doesn't pay the rent, doesn't give you the money to put your kids through private schools. So you need to be independently, financially independent to be able to do things like that. So one way of looking at all of these considerations is determining how these things stack up against your income. Income is here along the x-axis. And I know income's not everything, but you still have to pay the rent. So look at these other parameters along the y. Do you want to work a few hours or a lot of hours? If you want to work a lot of hours, it brings you way along here in terms of income. Do you want to be more involved in the talking specialties, the thinking specialties? Or do you want to be involved in surgery, procedures, and you know, things like radiology, procedural things? And the other parameter to look at, do you want to be involved in academic, public work, or private practice? So again, you work a lot of hours, your income goes up. If you're going to go into surgery, it goes up even further. If you're going to private practice, it goes really high. For example, let's say you want to be a professor of pediatrics. Well, you got to work long hours, it takes you up there. You're going to be in the talking specialty, so you stay around here. And you're probably going to be an academic, you're going to come down. So income's not going to be very great. Let's say you want to be a radiologist, a private practice. Well, your hours don't have to be too great, but you'll be procedural, so the income keeps going up. And if you're in private practice, it still keeps going up. Now, I know income's not everything, but as you get a little older, you have bills to pay, and it's one way of seeing how the community and other organisations value your worth. And you know, you still have the rent to pay and other expenses to meet. So I hope this very simple approach of deciding which area of medicine you want to go in based on a very simple x-axis of looking at income proves useful to you. And remember what I always say, try to enjoy your area of interest or specialty and put your best effort into it, provide good patient care. Thank you.